Fatigue and exhaustion not uncommonly takes over during cancer treatment, makes everything feel impossible. But what if there was a way to regain strength physically and mentally? A new homeopathic approach is helping oncology patients fight fatigue, restore energy, and take back control of their daily lives. And it's changing the game for millions worldwide.
My name is Amanda Butler. I am 35 years old, and I am proud to say I am a cancer survivor. I was diagnosed at 32 with stage 2 breast cancer, and I was at the peak of my fitness career. So obviously when I was diagnosed, it came as a big shock to me. I started 6 rounds of chemo, and then I did a double mastectomy. And then after that, they found residual cancer in my lymph nodes. So I had to do 25 cycles of radiation and 9 more months of a low-dose chemo. The effects of it are something I don't even think anyone is prepared for, no matter how much the doctors try to tell you. When I hit about the 5th chemo mark was when I just had no energy. I had to stop working, and it was just like a really big struggle for me to even just do one thing on my to-do list. I was already on so many meds, so I was like, it's time for me to go back to doing something a little bit more holistic, and that's why I really liked ENCER, and I still use it to this day. ENCER is a chewable tablet that you take twice a day, one in the morning, one in the afternoon. ENCER was giving me so much more energy just to live life, not just workouts and getting through the day-to-day stuff. It was really getting rid of a lot of the chemo side effects, the nausea, the vomiting. For those last 4 rounds of the chemo treatment, when I was doing ENCER, I didn't have any of that. I was able to wake up and have energy and just feel like cancer who. You can take this all the way through survivorship because cancer fatigue lasts for years after treatment. And so my life is back in full swing. It's really important for me to be able to keep up with my life of training, and I started my cancer organization called Cancer Baddies. So I have to be able to be there for people, and so ENCER is helping me maintain that energy levels throughout the day, even after treatment's been complete.
This revolutionary solution has the potential to disrupt the oncology market, and here to share more about her story is Amanda Butler and integrative medical specialist Dr. Pina. Thank you guys for being here. Dr. Pina Lo Giudice.
So good, thank you.
But we'll just call you Dr. Pina.
Thank you.
Amanda, how are you doing?
I'm great.
You
Thanks
look
for having
great.
me.
I mean, just remarkable. In the field piece we saw, I just felt so bad for you because you make a point in there that no matter what physicians tell you, you can't prepare for this.
Yeah, I'm definitely grateful for being able to go through the treatment and survive it, but no one prepares you for what it's like to go through that.
Did you notice change right away, or was it slow to come on? Or?
It was probably about 2 weeks I started noticing my energy coming back.
And Dr. Pina, how does this work?
So basically, ENCER is a homeopathic remedy specifically created for post-cancer treatment-related fatigue. And so it's this targeted 5-formulation remedy that's specific for chemo and radiation.
First, let's define what cancer-related fatigue is.
Right. So CTRF, also known as cancer treatment-related fatigue, but that's a mouthful, is this chronic, persistent exhaustion that is caused by the cumulative effects of chemotherapy and radiation. And unlike regular tiredness, it's not improved by rest.
I don't know why we would be surprised after beating people up with radiation and chemo that they would have this. It makes perfect sense.
Yeah, and you get a lot of side effects from those treatments, like she said, with the brain fog and the exhaustion. And people think, okay, I'll just rest and I'll feel better. But unfortunately, how the chemo radiation does change the mitochondria and in the body, people can have this fatigue, whether it could be years later.
Yeah.
Most people in the conventional medical model, there really is no other option for this CTRF in particular. But it's this particular blend that's allowing the body's underlying mechanisms to heal and basically become less tired.
I never really thought about it before until we sat down here, but that post-COVID syndrome and post-chemotherapy treatment fatigue is very, very similar in terms of clinically it's very similar.
Yeah. Right now, there's mostly ENCERs based on clinical research, so there are a lot of patients showing the benefits of using the product. And the great thing about with ENCER and the company is that they now just got approved for more scientific double-blind studies for the product.
I saw that on the website,
Yeah.
actually. They're talking about it. Is the oncological community embracing this?
We're trying to get there, so that is the idea, so that again, it gives patients an option, being able to empower empower a patient, really that in itself is life-changing.
I actually started with Cancer.org, and so I've given out ENCER products to a lot of people in my community who are patients and survivors, and a lot of them have really found a lot of benefits from ENCER.
I think what I'm excited about with the company is that really doing the scientific research behind it to really support it, and now they're even looking at, to change the formulation even for generalized fatigue, because so many people do suffer from that as well.
Well, thank you very much.
Thank you.
Congratulations on your progress.
Thank
Phenomenal.
you. Thank you.
So this potential solution can help people in some of their most difficult and desperate times. So I want you to find out more about it. Go to ENCER.store, ENCER.store, S-T-O-R-E, and we'll be right back.